Massachusetts Senator-elect Scott Brown was chosen in large part because of this promise.
I would be the 41st senator, but it would make everybody the 41st senator, and it would bring fairness and discussion back to the equation.
What he meant was he'd be the 41st senator to vote with the Republicans against Congress's current health care plans. If a compromise bill comes back to the Senate after Brown is seated and Republicans filibuster it, Democrats won't have enough votes to stop debate, and the bill could die. Democrats who don't want that have a few options. One, the House of Representatives could pass the Senate's bill as is. The Senate approved this bill on Christmas Eve, and if the House accepts it without changes, it would send the bill directly to President Obama for signature. Problem is, many representatives, including some Democrats, don't like some key parts of the Senate health care bill, and it doesn't look like the House will have enough votes to do this. Another option, try to complete a compromise bill between the House and Senate plans and then fast-track it through Congress before Brown takes his Senate seat. The cons? It could look unfair to the American public. A recent CNN Opinion Research Corporation poll found that most Americans are opposed to the congressional bills. And some Democrats who've supported these bills before say they may not vote for them again if that vote comes before Brown is seated. And in any case, President Obama says he's against any move to rush the legislation through. Democrats could try to pass reform using a controversial move called reconciliation. Bills considered like this can't be filibustered, just voted on. But it's an unpopular option because it's usually used just for the federal budget. It's also complicated. It would take a long time, and Democrats want to get health care reform passed and move on. Republicans want Congress to set aside its current health care bills and start over with negotiations. This would be a dramatic setback for President Obama, though, who's made health care overhaul his top priority and invested a great deal of time and effort in it. And it is possible the Democrats could strip down the bills they have to a smaller, simpler health care plan, more likely to pass both houses with Brown seated. It probably wouldn't be the kind of far-reaching reform that the president and Democrats wanted. But without a supermajority in the U.S. Senate, Democrats may have no other choice but to compromise with Republicans. Carl Azuz, CNN, Atlanta.